Good morning. I want to thank everybody who joins us. My name is Ola Atamanova, and it's my pleasure to welcome you at Ukraine Media Center today. So there was another horrible night for the whole of our country. So on behalf of our team, I would like to express condolences to everyone who experienced this terrible act of terrorism, another act of terrorism committed by Russia, and to wish the sinister recuperation to everybody who was injured during today's night. So today we have invited you to present a study on the blind spots of the medical examination committees. We'll talk about the way the system operates in Ukraine, what are the issues, and let me introduce our speakers. Joining us in the studio are Iryna Yakovets, co-author of the study, Analyst of the Media Initiative for Human Rights, and also joining us is Kateryna Tsymbolynets, head of the Patronage service of the 47th Separate Mechanized Brigade for the Combat Medic, and the unit's chief medical officer. Good morning. Thank you. Thank you for visiting us despite this difficult night. So let's talk about the study. Ms. Iryna, the floor is yours. Let's talk about the methodology. Let's talk about the goal of the study, what were the sources used, and let's hear about the results as well. Thank you very much. I really want to thank everybody who's watching us online and offline. So how have we come up with the idea of the study? We'll understand that since that moment, since the beginning of the full-scale invasion, the situation has changed in the front lines and in the country, and the system of the medical examination committees, which is an entry point for the people who join the armed forces during the different phases of the hostilities. It was fulfilling different missions. Well, first we were saying that the commission should be, the examination should be simplified so that people could join the armed forces as soon as possible. Then the people have seen that in the activities of the medical commissions there is a lot of issues, and our study, it was aimed at specifically identifying what were the issues in the activities of the medical examination committees. Just like they come up with the diagnosis of the people, in the same way we would like to come up with such a diagnosis of the system, what are the existing problems, what may be improved. So this study, it doesn't have any crucial role. We didn't set this role for us. We just wanted to state in an objective manner without any bias, without any additional layers of bias. What do we have for the time being? Where are we? Where should we head to? So to get the results, we were studying two key components. First, the quality component of the examination committees and the quantity component. So we prepared the appeals to the command of the medical forces, the Ministry of Defense, the Central Medical Examination, Military Medical Examination Committee. Also, we addressed the Ministry of Healthcare, and right away I would like to say that the Ministry of Healthcare, they don't even have any data, unfortunately. And our letter was forwarded to all of the departments of the Ministry of Healthcare in all of the regions. We were gathering information from the regions. That was complicated, and on top of that we had limitations in the study because we understand that some of the data is sensitive, and in a study we were only trying to cover the data that we were able to obtain officially without any restrictions. And on top of that, we engaged resources from the open sources like a joint court resolutions register, the publications in the open media, interviews with the military. We've analyzed the reports that Media Initiative on Human Rights is getting, including those on military examination committees. We were talking to the people directly who were undergoing those examinations, including the vulnerable categories of our citizens. And those results will be demonstrated to you as a booklet, and we'll discuss them a little bit too. So our key goal was to uncover the problem and to suggest our solutions. Right away, I would like to thank the International Foundation Iryna and other donors, other countries who support all those things, because we understand that now the budget is aimed at the defense sector and all the such things that require a lot of funding, and hopefully the partners will continue supporting us so we could make another steps, so we don't only have the study, but we could proceed to some specific actions. I would like to thank specifically the acting head of the Department of the Healthcare of the Ministry of Defense of Ukraine, Mr. Dmytro Samofalov, who was unfortunately unable to visit us. He had to be present at this press conference. He's a very progressive person, and he's aiming at progressive changes, positive changes in the activities of military medical examination committees so they could fulfill their duties. And now let's proceed to the results. So I'll be quite brief. You will be able to see the results on the screen. I will only stop at number of key points, which in the opinion of our team are of greater meaning and are more demonstrative. There will be a lot of figures. You may not delve deeply into reading. So we started with the key problems in the operations of the old military medical examination committees. Everybody had seen a lot of articles in the media. First, it started with bureaucratic difficulties. The procedure was very long-lasting. People were in lines. There were a lot of mistakes. Well, when it comes to corruption, it was only the lazy ones who didn't mention it, but we understand that another component, Ministry of Defense, was watching it too, and they started the reforms. So the reform was intended to be happening in 3 stages. In the first stage, the electronic prescriptions were issued for military medical examination committees, which proved to be an efficient step. It shortens time for such a prescription. It shortens all of the a lot of bureaucratic procedures. On the second stage, an electronic system of data capturing on the health condition was implemented, and the third stage contemplates the full integration with the electronic healthcare system of the Ministry of Healthcare of Ukraine. So these 3 key areas that were studied during our survey. So we started with the figures. What has the reform brought? First of all, we've increased the number of the non-staff military medical examination committees. Like this black circle is the staff committee, meanwhile the white circle is the extra staff committees. For example, starting with the year 2022, the number has grown more than twice, and we were intending to expand the options for the people so they could undergo the examination in different healthcare facilities. When it comes to regulations, the order for O2, known to everybody, which not only regulates the procedure of the operation of the committees, but also the list of medical conditions due to which the persons are recognized as either fit or unfit for military service, depending on the structural units. So again, I've already mentioned that we should start with the figures. So for the time being, the number of committees increased, as well as the number of people who undergo the examination. The schedule for the year 2025 is not quite illustrative. The year has only just started, but for example, previously there were 15,000 people undergoing examination, and in the year 2024 the number has grown to more than 40,000. And the interesting trend that we've identified, that the more is the number of people who undergo the examination, the more is the number of people who are being recognized fit for military service. We cannot say that all of the people have gotten healthy right away, but we've linked it to the changes in the resolution 402 And with the expansion of the number of medical conditions that render people unfit for military service, also helped to grow the number of those who are recognized fit. And at the same time, the number of resolutions about the persons being unfit to military service is getting reduced. For example, in the year 2022, such number was 124,000, and in the year 2023, it fell down to 93,000, which is an evidence of a significant reduction. Another figure that we paid attention to is the shortening of the term of examination. In the regulations, it says that the period of examination should last no longer than 10 days for the draftees and 15 days for the active servicemen. So the resolution was positive about the reduction of the term because it didn't relate directly to the shortening of the term, as they say in Telegram channels, to peg the people right away. But it was made in order to prevent the people from standing in lines, and such term was shortened. For the time being, the term of the examination is about 2 to 3 days. The Ministry of Health was inspecting the operations of military medical examination committees in the city of Kiev, and that was the term that they've documented. But there is another issue. In the green square, you can see that the resolution number 402 contemplates the list of mandatory tests and examinations the people should undergo as they undergo the military medical examination committee. On one hand, the healthcare services directly perceive it like they were told that the examination should be taking place within 2 to 3 days, and they try to expedite the process. However, it shouldn't infringe the quality, and the number of such tests cannot be taken within 2 to 3 days. And 2 to 3 days, which the Ministry of Health orients us, is not the ultimate truth. Nobody is saying, I haven't heard any guideline that would say that the term of the medical examination should be no more than 3 days. It's only about the maximum reduction in cases of those people in whose cases it's possible, but it shouldn't influence or affect the quality as contemplated by the resolution 402, but such issues are still in place. Here, I think you all know that in order to make sure that people have maximum access to the simplified medical examination procedure, we've established the committees in the healthcare facilities, which are usually called the civil military medical examination committees. Usually, those are the healthcare facilities that submit to the Ministry of Health of Ukraine, and we requested information from them about the operation of those medical examination committees, and we've identified significant problems in operation of the military medical examination committees that submit to the Ministry of Healthcare. First of all, the Ministry of Healthcare doesn't have any information about the number of such committees, so in fact they don't exercise that influence over the military medical examination committee that is intended to coordinate their activity. There is no documenting of the number of draftees. You know that there is a primary examination that is happening within the package of medical guarantees that is paid for by the government. So in order for the healthcare facility to get the money for the military medical examination committee, they should submit to the Ministry of Healthcare the calculation of a potential number of draftees that they are about to service, and they don't have such information. With my colleagues, as we were making this survey, we failed to understand how does the National Healthcare Service extends the funds if there are no data. Nobody is doing any calculations. However, they're supposed to be done. We have the mobilization plans. We have the number of draftees kept by the military administrations. A lot of healthcare facilities submit to them, but we don't have planning and registration of the potential number of the draftees, and we, not us, but the utility companies cannot calculate the numbers. we don't have the statistical reports, that we don't have relevant forms approved by the Ministry of Health or Ministry of Defense. There is no number of people who underwent the military medical examination. And we were just responded by that nobody has such data, nobody keeps track of them. So we are convinced, we are confident that the activity of those medical examination committees should be improved at the level of the Ministry of Healthcare. We are arguing whether the system should be united, whether the data should be extended about the healthcare, whether the human rights are not infringed. So at the local level, it would be easier to test all those elements in order to select the best option. This is not being done today. Basically, there is an impression that every single committee lives its own life. Apart from some letters from Ministry of Healthcare, which were saying that the examination should be happening as soon as possible, that there should be prevention of unjustified protraction of the examinations. And this is it when it comes to the function of the Ministry of Healthcare. And now, if we take a look at the financial costs, we've gathered the data from different structures, and the total number of people who underwent the examination in the year 2022, you can see the increase, by the way. It's not so big in absolute numbers. In the year 2022, 1,300,000 people underwent the examination. Within the year 2024, 1,600,000, and within the month of January 2025, 152,000. If we take a look at funding, the amounts allocated for examination per one person are really small, so we've divided that amount into the number of those who underwent the examination, and we got the figure that the examination was costing 166 hryvnia in the year 2022, and the year 2024, it was 197. Well, I doubt that normal tests can be taken along with normal examination at such cost. I mean, I'm convinced, I'm talking on my behalf, not on behalf of the team. I think that the Ministry of Health should be playing the key role, because there is no calculation of cost, no calculation of needs. You cannot even calculate the cost of the health package that exists for today. So what does the mobilization of the people with medical conditions entail? Well, first of all, there are three key aspects that we've identified for ourselves. First of all, the losses for the battle capabilities of the armed forces. Everybody understands if a person with a medical condition ends up in the armed forces, the fulfillment of their duties and tasks is doubtful. Their capability to fulfill that task is doubtful. Some medical conditions may create even a threat for those around the people with the medical conditions. For example, the patients that were getting replacement therapy and now they're deprived of such replacement therapy in the front lines. We had examples like this when such people can do damage even to those with whom they've served. So they create threat. They're dangerous in their essence if they don't get any treatment.
Moreover, this is losses for Ukrainian budget. When a person with disease is mobilized and gets to the training center, for example, or to the service place immediately, it cannot fulfill its duties. That's one, and then the state cannot is paying twice basically for the consequences of such malfulfillment of duties. And when a person is mobilized and can't fulfill its duties and its tasks, it will suffer, and there is highly doubted that such a person can fulfill its duties on a necessary level. The system of medical commissions requires further reformation. You may have heard in media that there is initiatives for development of the diagnosis, that the 2 or 3 days are not enough. We understand that before now there was violations of procedures when we are talking about medical commissions, and also we have many decisions from courts that the medical commissions were not adequately arranged, and we also taken into account that there is a human factor. We were talking to the people that are working in those organizations that are involved in medical commissions. So our main goal is to prepare the reforms, legal reforms for this domain. So now we are concentrating, now we are focusing on not getting sick people into the army, basically. So this is our main goal now, because this is going to cost the government twice. So we don't have a necessary accounting system for the mistakes that are committed during the medical commissions. So up until now, not a single decision was reversed. For example, we don't have a single decision that is recognizes that there was a wrongful decision about the state of health of a person. So there were definitely decisions when people that were recognized as not capable of, not apt for service, they were recognized apt for service instead. So this process is going only one way. And I'm deeply convinced that that this is the sign of a bad functioning of the system. So we were also checking the what problems we have in the Ministry of Health medical commissions, and what court decisions were made, and we are seeing a picture where we don't have a transparent processes of appealing the decisions of the medical commissions. If we are going to introduce electronic services, this is one thing. However, when people are getting their mobile phones taken away from them when they are recognized fit for service, then how such a person can appeal the decision of the medical commission? When we are talking about the reform, we have to base on the principles of the human rights, transparency. If such principles will be followed, then the system of medical commissions will work much better. And these are recommendations of the Ministry of Defense of Ukraine. They are proposing to introduce monitoring of the people with chronic diseases in the zone of combat. Because, as you may know, there is information that there are people on the front lines that require frequent, periodical medical treatment of some kind. We don't have any kind of confirmations of such information, so this is something that we need to study yet. Also, we need to as you may know, it is much harder to demobilize a person than it is to mobilize a person, and this has to be changed too. All the people that have diseases some kind of sicknesses that are not that makes them not fit for service. They have to be somehow transferred from those places that they are serving, and also attention has to be paid to the access of the people retired from service to the medical substances. For example, the bottom line of our analysis shows that Ministry of Health and Medical Commissions is not working well. It's not accounted for, and there is no cooperation with the Ministry of Defense of Ukraine. There is no informational campaign that would explain how this system is working. And we have bodies among the medical commissions of the Ministry of Health system that were not addressed to even one single time, and this is nonsense. Also, it is necessary to improve the education of the medical personnel. This will greatly improve our defense capabilities. It is obvious. All those recommendations will be passed to the Ministry of Health of Ukraine, and we are ready to work together, to cooperate, and I would like very much to have a constructive discussion like the one that we have with Mr. Dmytro Samofalov, which is very constructive, and this is all I wanted to say. If anybody has any kind of questions, I'm ready to answer them. Thank you, Ms. Iryna. Thank you for such a fundamental study. We have a question. You said there is no procedure of appeal after the medical commission has taken place already. Do we even have some kind of numbers or reasons why this mechanism is not working? I didn't say it's not working at all. I said it's working with some violations, but we have a hotline. But we have a person here in person that couldn't reach a medical commission via phone. But we don't even have address where the appeal could be submitted to. Also, there is no procedure for anonymous appeals, anonymous complaints. There is no such procedure in place. But I would say that such things are really required in a democratic society, that people could report when they see something wrong. For example, with the work of the medical commission, and as things are standing today, a person after medical commission doesn't have even means to address or to appeal the decision of the medical commission. So if we have, for example, letterboxes for complaints, for anonymous complaints in the places of conducting medical commissions, it will be a positive influence on the whole system. Transparency always makes systems work better. Like we either have to completely support or not support at all the system, and as we are if we take, for example, statistical numbers, we have 95% of cases when people do not comply. However, those 5% that need to be covered also required. Thank you, Ms. Iryna. Ms. Kateryna, the question is for you. Have you seen any kind of cases when we had unqualified results or conclusions by the medical commissions, some kind of violations? Yes, glory to Ukraine, glory to heroes. Yes, indeed, I have a big experience. I served in a military unit, in a battalion. I worked in other medical units within the defense of Ukraine, Ministry of Defense of Ukraine, in the armed forces in Ukraine, and I can say that there is a great need to improve the way the medical commissions are working. For example, I was mobilized without any kind of medical commission. It was at the very beginning of the full-scale invasion, and we were de facto assigned to the units without any kind of medical. But at the time, there was a great need for the military servicemen. There was a lot of volunteers at the beginning of the full scale. However, in 2024, we had another wave of mobilization, and we stopped having an opportunity to select people into the units. So before we had a choice where to assign, which unit to assign a person to. After that, we don't even have this choice anymore. And right now, some of the personnel are having some kind of chronic diseases that do not make them unfit for service. However, they do need some kind of medical attention. And for people like that, we have specially assigned positions, and there is a list. So we are having people sent to us, people that are fit for service officially, and we start to double check their health, and we understand that these people have some dangerous diseases that have to be taken care of, that are not fit for service, and among those are hepatitis, AIDS, and also we even had a case of scoliosis with one of the persons that were mobilized. The person actually wanted to serve, but the problem is when this person wants to retire, there is no legal way of making him retired and receive medical treatment. So right now we kind of have this presumption of guilt. Like if you didn't prove that you are not healthy, you have to serve, and this is not right. Or sometimes some kind of medical results, or for example, private clinics, doctors' results, or conclusions about the medical condition of a person is not taken into account and is not recognized by official bodies of medical commissions. And this is ridiculous because my case, for example, is not this critical. But how many times we had boys coming to us with some kind of disease, and we didn't know about it. And then his comrades start, his brothers in arms start to note that he is a schizophrenic and has 4 personalities in them, and this is really dangerous. His colleagues started to notice that he has these fits of his disease, and we had to work hard to make it so he is recognized as a person with a disability, and he was tossed around different medical facilities from different governmental bodies. So we had to arrange guards for him, because it's all about military stuff, you know. There is arms, there is so unfortunately there is cases like that, and another one we had is a person has disabilities in terms of his cognitive capabilities. He couldn't write or read or sometimes understand what he is told. So we had a long and hard work done for him to be retired correctly, you know, in a correct way. That after that, this person could have some kind of treatment from with governmental support, medical treatment. However, it's way worse when some kind of tragic events occurs. You know, like a person that was that had some kind of sickness gets diseased at the combat, and how exactly we are supposed to explain to their relatives how this happened. And also, we need to take into account that some diseases only show themselves only in the symptoms sometimes show during stressful conditions of the front lines, you know. So the medical commission taken place, and only after some time a person finds out, and only afterwards it is found out that the person had some kind of sickness, and there is a lot of losses even for the government that needs to pay for all this, you know, to pay compensation and stuff. We have sometimes people recognized as fit for service with broken legs. You know, this is we need quality experts that are capable of making right decisions. You know, to actually do the work, because it is impossible to actually prepare a person to do a medical examination in 2 days. So what we have seen on those slides, is it sufficient? Is it sufficient to do those medical examinations? Yes, it is true, but the point is that the additional or double check or other kinds of examinations are not conducted. They are not given the chance. The people that are doing medical examinations are not allowed to do additional medical examinations. You are not allowed to go to a civilian facility to have additional consultation. Ms. Iryna, you said you had also recommendations. Among those recommendations, what can we do quickly? What can be done with ease? What can be done in a short time? Well, of course, it's a resolution 402. It needs to be reviewed. Second, we need to include the Ministry of Health into this process more actively. we will start with what Iryna just said. People have to have opportunity to undergo the full-scale medical examination in any kind of facility of their choosing. Not only by the state or Ministry of Health Medical Commission. So this order and the Ministry of Health, these are two things. Dear guests, if you have any kind of question, please. Hello, I'm Stanislav. Thank you for such an interesting report. I have a question. When we are talking about the medical commission problems, do I understand correctly that it's a collegial body, and there is a lot of signatures and stamps of doctors? Well, it had to be a collegial decision about the decisions. I don't know, but to make anybody responsible, it is factually impossible right now. Do we have to work in this direction? Does the legislation maybe required to be changed? Thank you for your question. Yeah, possibly you have heard. Yeah, we had attempts to introduce changes to the legislation, and we even had the criminal responsibility introduced in this proposition, and like wrongful mobilization should have been recognized as a criminal responsibility. When we're talking about criminal responsibility, there need to be structures that are regulating such kinds of responsibility, and I don't think it's a very good idea, because it will result in a worse operation of the medical commission, not better.
I would like to proceed to the changes. You see, the issues with the committees, with the examinations, are two fundamental things. First, imperfection of legislation and human factor. Because fighting human factor, with some punishment, it's not the best way to do it. And this is exactly what we've written in the results of the survey. Subjectively, it's coordination of the activities of the committees and normative changes. Also, we could bring the committees to liability, but first we need to state the fact, to corroborate the fact, and then the erroneous directness is, even if it's disputed, it doesn't necessarily mean that medics might have committed a mistake, because according to all of the canons, the medics may have omitted anything, but if they comply with the protocol, there will be no liability whatsoever. So they should go to the court, and even based on those resolutions, to prove they didn't comply with the resolution 402, first, the proceedings, they take at least half a year, and people may already end up under Pokrovsk by the time that the court makes a ruling to bring the medics to liability. And that's why we've written in our recommendations that there should be relevant organizations that in fact are supposed to coordinate the activities of the military examination committees. They should gather all of the information and respond right away. The information can even be gathered directly from the military medical examination committees. And for the time being, there are options, there are possibilities to bring those medics to liability or to make amendments promptly. Kind of like this. Any more questions on the floor? Well, can you please make an assessment of medical examination through healthy application, and are there any other options like this? Well, I cannot make an assessment. To make an assessment, we need to study this topic profoundly, but we're not talking about having medical examinations through healthy. It's about having the systems integrated and to be able to obtain the data about health conditions from those healthy applications. For the people who use healthy, for those who attend the doctors, well, in fact, it only documents the medical conditions history, but if I come to a doctor, say, starting from the year 2029, what's going to be my illness story? We need to make sure that healthy doesn't become a proof that a person is healthy. For example, if you don't use this healthy application, then it means that you're healthy. So for proper diagnosis, I insist that the systems should be integrated, because sometimes people may have medical conditions that are not reflected in healthy, but when it comes to the medical systems, the doctors who work with the healthy, they complain that the system isn't perfect, it keeps hanging, it keeps freezing, there are some technical issues. So the information that they exchange should be objective, and it should be contemplated that if a person wants to have the data extracted from healthy, the medics should not come up with the resolution before the data is extracted. So, the medics, I come to private doctors, it's more convenient for me, and they don't preserve any data. So according to healthy application, I'm absolutely healthy. But if you consider it from a different standpoint, you see the situation might be different. Well, microphone to the first row, please. My name is Oleg, and I incredibly appreciate the fact that you've touched upon this important issue. Why I appreciate it so much? Because it's a difficult topic. It's being omitted. There are a lot of additional speculations and comments that are really unnecessary. And currently I represent those people who, back in the year 2023 and then in the year 24, after the amendments to the resolution number 402, have become drastically fit for military service. Some people have incurable chronic diseases that are listed in the International Medical Conditions Classifier, those that are supposed to be provided with replacement therapy or other types of medicines. The people who are supposed, and I know the men and women who were defending their motherland, their homeland, but it was based on the call of their heart, and it was, it was their will. And currently, the thing that you're doing, I call it the first link, when the police, with the representatives of the draft offices, together with the commissions that should be a part of those who need to defend our homeland, they work together, so to say, in cahoots, and sometimes the people are brought to the units and they are being recognized as conditional fit, and the military units don't accept them, and then the people are being turned into fit for military service within 2 weeks. And in those units, such things arise as AWOL and other unpleasant things, and there is some wise and probably very influential person who updated or amended this resolution without clearly realizing that they break the law, that there are different articles in the constitutions on top of the one that every single citizen should protect their homeland. So they transformed the people with chronic diseases into those fit for military service. So why me, as a person who has incurable chronic disease, even who has repeated cases and is confirmed as being observed by a medical institution, why should I prove something to somebody against my own will? Even if I'm liable to the country for something, I'm being registered by the conscription office, so send me a notification that I have to undergo some examination. I'm gonna bring my history, my personal history. I have a person who can say how it happens. So They bring you to the site of a replacement therapy, they put you on a bus, and here you go. So the person, even without being guilty, they are supposed to prove something, and it violates any dignity. They take away the mobile phone, they restrict your freedom. How can you prove prove them your right? How can you prove something? Not because I want to be what they call a deviator or deviant, and I just want to live in a country. I know the guys who, even with severe medical conditions, even without being properly fit, they wanted to go to the very forward edge of the battle area to do things there. So again, I want to emphasize it. My opinion, these cahoots and the basic link who are supposed to fulfill their functions as the conscription office. And I really appreciate your comment. The resolution 402 is supposed to be amended because those people, they are not only non-professional, they do harm to all of the country, to the people who are supposed to defend their country rather than to ensure the security for their units. They are supposed now to think about other things. Well, a small remark, if I may. I apologize. I wanted to mention it after you. So in our study, what we suggest is to calculate the need for the servicemen who would undergo military service in the support and supply units, including the conscription officers, because they come in bigger numbers than there is a need. And then the question arises, why spending funds and mobilizing such people if there will be no need for them? So again, it should all be reflected in the master plan that, for example, we need 20 people and only 2 of them are conditionally fit, as we call them. So yeah, this is our suggestion. Then I apologize, Victoria. And I wanted to say that unfortunately, disputing it when you end up in the training center already, it's impossible to dispute anything because the people are getting deprived of their phones. You spend 2 months there, then you end up in the military unit, and you don't have either opportunity or time to dispute or contest the resolution of the military medical examination committee. Meanwhile, you may be fit for example, for logistics. You get the position of a grenade launcher, but somehow you are fit for another position. Thank you for the study. Unfortunately, the Department of the Healthcare is not attending today. So what is the joint vision? What is the common vision that you have with the Department of the Department of Healthcare of the Ministry of Defense? I'm not going to say anything instead of Mr. Dmytro. I really want to thank him. He and his team, first of all, they are ready to recognize the problems, and our study is perceived by them as support in identification of the existing problems. So there is no such thing as existed previously in the government organizations. So in the government offices, they say like, yes, there are problems. We need to formulate it. We need to articulate it properly, and there is a will to work on the changes, on amendments to the resolution 402 and other procedures to make sure that the military medical examination committees are efficient and they cover the needs of our armed forces. That's why I think, Mr. Petro Markiris, I hope for the fruitful cooperation, and hopefully there will be some changes taking place shortly, some positive changes. I'm having a question to Ms. Kateryna. So based on your experience in your military unit where you've served or where you keep serving, the people who were coming to your unit to serve, those who were getting antiretrovirus therapy or replacement therapy or any other chronic mental conditions, health conditions, do they get any treatment? Do they get any medicines as they end up in the military unit? Well, I can tell you about the Brigade 67. I was the head of the medical post. Yeah, we had such people, and they were getting all of the necessities covered. Well, we even had one volunteer who had AIDS. Unfortunately, he died, but he wanted to die with his diagnosis in the battlefield, so we were treating him with understanding and respect. We provided everything that he needed because we were respecting his will to continue fighting against the occupiers, to fight against his disease, and to support his health. I really have a lot of respect to these kind of people, and we treat him with understanding. I cannot tell you about the rest, but I think that the problem still exists, and unfortunately, well, it's not a secret to anybody. You know, we have servicemen from the risk groups. They come from prisons. They need support in therapy in case of such health conditions as hepatitis. Well, probably there are such problems in other units because there are people who are unaware of their health conditions. They only find out about them during the service itself, and to be able to continue serving in the logistic structures, they have to get re-examined by the military medical examination committees. Well, for the time being, there is no centralized supply of these kind of medicines to the area of battle operations. Usually, such things happen through the relatives, and the relatives have no right to get such a medicine without power of attorney. So it's all based on personal contacts, which is not right. So we try to mention it in our study, like either let's not send these people, or let's think about logistics to make sure that those medicines, they reach them. Yes, there should be a system built in the command of the medical forces, between the commanders of the battalions, the heads of the medical services of the units, and the people are supposed to be getting all of the necessary medicines. The same applies to the sugar diabetes. If persons end up in the positions, you know, that they want the food and water and ammunition delivered to them, let alone the medicines. Yeah, but such people shouldn't be staying there in case they have any such diseases, any such health conditions. They either have to get their medicines staying at logistic positions in the rear somewhere, or not to be appointed to the positions in the front lines. Well, we keep forgetting that the war will be over, and the state of Ukraine will be experiencing the negative consequences. We have some resolutions of the European Court for Human Rights when people were deprived of their replacement therapy in the prisons, and Ukraine was paying them for such bad resolutions. And I really want to avoid the cases when we have when we are being sued by the relatives of those who unfortunately perished. And so let's remember that the war will be over, but the obligations of Ukraine will rest. Do we have any more questions? Dear friends, Yaroslav Latko, Suspilne. First of all, I would like to thank you for the study, but I fail to understand whether you've identified who is personally liable for such a condition of military medical examination committees. And now, during the year 4 of the war, it's surprising to see the Ministry of Healthcare, which fails to provide electronic medical card for a mobilized person. Like for example, a person gets mobilized and there is all of the medical history in the medical card, let alone the Ministry of Defense. There is a deputy minister in charge. They were changed a lot, and I really appreciate that Mr. Samofalov is so progressive, yes, but he's only the head of department. Today he is here, tomorrow he's not here anymore. So in your opinion, who should be directly liable, which institution or person, so they could be asked directly, just in the way Stalin was doing it.
Елсі, у вас там є?
Do you use Halsey? Do you have all your biographies? No, I don't have. This has to be introduced, you say. Well, see, first of all, we didn't have this goal to define or determine personal responsibility. Secondly, our system of medical commission is built in a way that is problematic. When there is a lot of people responsible for something, there is things that go badly, and we don't have a single person responsible for the activity of the medical commission. We have different, all kinds of medical commissions, like governmental, non-governmental, and this is one of the problems that we are talking about. There is not a single coordinating subject that has to be created. I think there has to be two, Ministry of Defense and Ministry of Health. If we're talking about medical domain, for example, the key actor here is Ministry of Health. And I'm very convinced that the Ministry of Health is self-removed from the process of the medical commission's conduction. We are receiving commentaries that we did this, we did that, we did what we are responsible. But there is no coordinating role. When we don't have a coordinating subject, and I think all the medical commissions have to be coordinated by the Ministry of Health in the medical portion. Has to be done by the medical commissions arranged and conducted by the Ministry of Health. Ministry of Defense has to take care of the paperwork mostly, like do submissions of data, of requests, and so on and so on. Ministry of Health has to be the actor, has to be the one that exercise the. I didn't say that they have to be responsible, but I am hinting at it, But well, they have to start. They have to start parliamentary procedure. Yeah, I don't like when somebody's saying, somebody has to be, or let's start parliamentary discussions. We have completed the first step. We have completed the first, which is analysis, and now if you have a kind of concrete propositions as to what has to be done, I also want to say that the goal is not to find a responsible person and to punish them. If you know how it goes in the history, if we start punishing everybody, if we start some kind of process with punishing somebody, the process is not going to start. We're going to punish and punish and punish people, but the system will not improve at the same time. So we are suggesting starting with the reformation, not with punishing. All right, so we understand that we talked today about the medical commission procedures and how exactly it is happening, and I understand that the Ministry of Health does not have any kind of feedback from the people that they are actually conducting the medical commissions with, what do you think about the civil sector of our societal life? What do you think about if this kind of information could be incorporated into the process of reformation? I am ready, and Iryna is ready, but here we do have a question of the material support. This question does exist, and it is critical, and I would like to thank to those organizations, to the representatives of those organizations that are helping us. They are present here today, but with time we will get to Ministry of Health, we will get to the Ministry of Defense, but right now we as a representatives of the governmental sector, we are thankful for this opportunity. We will to do this analysis, to do these recommendations, and we are ready to continue. The studies of the civil sector will continue, because there is of course bias. Yes, I agree, there is bias, and this is why we're asking you, and we're hoping that you will continue this activity. And I would like to thank you for this for your work, for your constructive thoughts, and I think we all understand the importance of improving this system, this process of conducting medical commissions, and what's most important is the results and reforms. Thank you, everybody, for today's and also to the I would like to thank the people, the organization that helped us immensely. Thank you, everybody. I would like to thank our forces of defense, thanks to which we are capable of gathering here. And glory to Ukraine, glory to the heroes.